Hello and welcome to session 2 of the medical debate, in which we'll be discussing ethics and modern medicine. We're going to be looking through a few examples and case studies of ethics, and in particular the 4 ethical principles or ethical pillars, and we're going to be applying these to a few situations. So in today's sessions, we're going to be recapping the 4 pillars of medical ethics, which we discussed in the first session. We're going to be looking at an ethical dilemma. We're going to be looking at an example BMAT question after that. And finally, we're going to be looking at an example interview question. So, firstly, do you remember the 4 pillars of medical ethics from last time? If you do, just write them down and see if you can briefly define each of them. Try and come up with a definition and perhaps an example of where they'd be used. We'll give you a minute just to do that now, so please feel free to pause the video and have a think and try and see what you can remember. Okay, so hopefully you've had a think about the 4 pillars of medical ethics and try to remember what you know about them and how you might go about defining them. So, let's first of all look at autonomy. This is whether the decision that you make respects an individual's right to make their own decisions, i.e., are you looking at a patient and what they want? Are you respecting their choice in their treatment? And autonomy is something which I consider to be the most important medical pillar. I personally believe that it's very important that patients get a say in their own treatments and that nothing impedes their own decision. After all, medicine is about caring for patients. It's centered around patients and their own personal well-being. And if a patient is uncomfortable with something happening to their body, then it shouldn't happen to their body. And that's why autonomy is so important. It respects a patient's right to be entitled to their own personal treatment, whatever kind of treatment they want, even if it comes into contact with the 3 other medical pillars. And autonomy is something which we'll discuss again in many, many future sessions, because it links so much to the idea of consent and to the idea of competence. We'll learn in future sessions about certain patients who aren't competent to make their own decisions. And this might be due to them not having the mental capacity to make their decisions. We'll look at Gillick competence as well. We're going to be looking also at patients who perhaps have certain mental health conditions and therefore they're unable to make an informed decision about their treatment. Remember, autonomy only applies when a patient is given the full amount of information regarding all the treatments which are available and which are offered by the NHS. For example, they're able to weigh up the pros and cons of those treatments and then come to an informed decision. Remember that it's important for a patient to have full access to truthful and reliable information, and that's where the doctor comes in. The doctor should present these courses of treatment, outline which ones they personally would recommend, but at the end of the day, it's up to the patient to decide whether it's good for them and it's what they want or not. That brings us on to the next pillar of medical ethics, and this is beneficence. This is whether the decision you make benefits the individual, as is hinted by the name. Is your decision made with good intent? And this basically means, is what you're doing the best outcome for the patient? Does it have the best outcome for the patient? Does it do what's best for the patient? And this can be interpreted in many ways. For example, if you help a patient get better, to feel healthy and safe, then you could argue that you're fulfilling this pillar. Equally, if you're not treating a patient and that's what they want and that leads to a better quality of life for them or better mental health, for example, then that also can be classed as beneficence because it's doing what's in the best interest of the patient and it benefits the patient. And this is sometimes confused and also quite similar to the 3rd pillar, which is non-maleficience. This is whether the decision harms the individual emotionally or physically, i.e., does it cause them any pain or does it cause them any suffering? And if you were making a decision which would lead to any of these things, then you could argue that that's morally wrong according to this pillar. And in many cases, making sure that a patient receives care that helps them emotionally and physically is also obeying the other pillars, but in some cases it isn't. Sometimes a decision may harm a patient, or it may not harm a patient, but it's what a patient wants, and it's the best for the patient. And we'll look at an example of this in the future and also later on in today's session. The final pillar of medical ethics is justice, and this is whether the decision that you make is legal and fair, i.e. are patients all being treated equally. We know that according to the NHS, which is the health service in the United Kingdom, all patients are entitled to equal treatment, they're entitled to the same treatments in most cases, and no patient is allowed or entitled to more treatments or better treatment than any other patient. No patient should be discriminated against due to any kind of factor in the majority of cases. And also, is the decision legal? Is it obeying the law? And is it doing what's best for everyone, you might argue? Is your decision going to benefit multiple people or as many people as possible, instead of just prioritizing one patient over another? So that's a brief outline of the 4 pillars of medical ethics. Hopefully you remembered them all, but if not, hopefully now you can, you understand what they're about, and you'll be able to apply them to the situations we're going to cover in today's session. So we're going to start by looking at an ethical dilemma. And this is a very famous dilemma, which I'm sure you've come across before, and it's one that's often asked in interviews, for example, just to see how you might think, how you might go about answering the questions, and it's really important in this situation to use the 4 pillars of medical ethics. So this problem is known as the trolley problem, and I'm going to read it out to you, and then we'll discuss it together. There's a train hurtling down the tracks towards a junction. On the right branch, there's a man who has fallen onto the track. On the left branch, there are 5 workers repairing the track. You're standing by a switch which can divert the train onto one of the 2 tracks. Which do you choose? Now, it's unlikely that you would come across a situation like this in real life, but it's a very good way of making you think about the 4 ethical principles and how you might apply them in this situation. You might want to look at beneficence. Are you doing what's best for the people? And would diverting the train have a better outcome for the people than if you didn't divert the train? Also, if you're looking at autonomy, what do the patients want? Or what do the people in this case want? If a certain patient doesn't mind dying or wants to die to allow the others to live, is that something that you should take into account? Equally, if in the group of 5, one of them doesn't want to live and the other doesn't, is that something you should also take into account? Justice is equally important in this situation. If you're looking at trying to get a decision which is fairest for the most people or helping the most people, is that something you might take into account when you're making your decision as to whether you should divert the train or not? And equally, non-maleficence is something that can't really be avoided in this case, as you are causing a harm regardless. But perhaps you could argue that killing 5 people as opposed to 1 is less harmful, or rather more harmful, than just killing 1 person. So we're going to look at how you might go about answering this question using the 4 pillars. But first of all, we've got a couple of other questions which might be interesting to think about. What if the man on the right was a child? And what if the 5 workers were all married with children? Would that affect your decision? Should that affect your decision? Remember, in terms of justice, all patients are equal, or they should be treated equally. Should a child's age or a person's age determine the treatment they get? And should a person's family or the fact that they have family whereas others don't affect their treatment, because it will have more knock-on effects? And this is a dilemma. There isn't a right answer as such. However, doctors will have to deal with dilemmas regularly. It's up to them to decide on an option, to try and come up with an answer, taking into account all the information that's available. So we're going to ask you now, what do you think? What would you do in this situation? And since this isn't a live session, you won't be able to comment your answer in the chat box, but it might be worth writing down your ideas using the 4 principles and thinking about how you would go about answering this question and what you would do. Try and back up your points using examples. We'll give you a minute just to think through that and try and come up with an answer. Okay, hopefully you've had a chance to think about that question and come up with an answer as to what decision you would make if you did make a decision using the 4 principles of ethics. And before we go on to the BMAT question, let's think about how you would answer this question. If you're talking about beneficence, you would want to think about, you know, what if you're doing the best for the patient. And you could argue that killing one person and saving 5 is doing the best for more people. Equally, you could argue that from a non-maleficence point of view. If you're harming one person as opposed to harming 5, that could arguably have a better or stronger outcome, since it's not harming as many lives. However, you know, if the 5 patients also had families, that might also lead to less harm, and therefore you're doing perhaps a more ethically right thing in that situation. In terms of justice, as we've discussed, it's not, you know, should one patient's life be valued over others? It's a tricky decision to make, and equally with autonomy, we don't know. We would assume in this case that patients don't want to die, they don't want to lose their lives, but if someone wanted to sacrifice themselves, would that be something you take into account? This is obviously not a medical situation, but we're going to be looking at some medical situations later on this session and also in the future, which you can definitely apply these principles to. So now we're going to move on and look at an example BMAT question. And this question, I'm just going to read it out to you. It's quite a long question, which you will get in the BMAT, but it's important to look at all the information you've got and try and work out what you would do. Right, so I'm just going to read out the question here. A mentally healthy pregnant woman has a severe injury in her abdomen, which must be operated on via procedure A in order to save her life. However, carrying out procedure A would kill her baby. It's possible to remove the baby and save it via procedure B, although this would kill the mother. A third procedure, procedure C, is available whereby both the mother and baby can be saved through surgery, although this has a 10% rate of survival for both parties. The woman's husband is on his way to the hospital, but he is currently uncontactable. By the time he arrives, only procedures A and B will be available. The woman has told you that she wants to undergo procedure B, and in this procedure, she would die, but the baby would be saved. Now, the question we've got is, what would you do in this situation? And it's a multiple choice question, so there are only 4 options here. The first is carry out procedure A, which is where you're saving the mother, but killing the baby. You could carry out procedure B, which is what the mother wants in this situation, and this is killing the mother, but allowing the baby to live. You could carry out procedure C, which has a risk of, you know, only a 10% survival rate, but it is possible to save both parties. And also procedure D, which is waiting for the father to arrive and asking him which of the procedures of A and B should be carried out. Now, there's a lot of information here and a lot of points that you could look at, but it might be worth just pausing the video now and having a think about this question and how you would answer it. So please feel free to pause it. Try and use the 4 ethical principles, the 4 pillars of medical ethics in your answer, and try and come up with a solution to this question. Try and think about the pros and cons of each of the answers, but also try and think about what the answer to this question might be, because there is a right answer in this situation, which you would have to follow in this situation. Right, so please feel free to pause the video at this point. Okay, so hopefully you've had a chance to pause the video and have a look through this question. So, the answer to this question is indeed to carry out procedure B. And this is due to the sole reason that the woman has told you she wants to undergo it. That is the correct answer in this situation. Unlike the previous situation, this isn't a dilemma. This is a real possible medical situation which does have a solution. You would have to carry out procedure B, and I'm sure many of you will have identified the reason for this is autonomy. The woman has told you that she wants to undergo this, and autonomy in most cases overrides the other ethical principles. Because we can assume the woman is competent to make her own decision, therefore we would take her suggestion of carrying out procedure B, even though it would kill her. Some of you may have selected options A because it would save the woman. You might argue that she is, oh yes, and also in terms of procedure B, we can see that she's mentally healthy, so we know that she is probably competent to make that decision. You may have argued option A because that would kill her baby, but not the mother. And since the baby hasn't been born yet, you could argue that the death will not have such a knock-on effect since the baby's life hasn't started yet, whereas the death of the mother might have a knock-on effect in terms of the husband and family and friends, etc. And you may have looked at the reverse for procedure B if you'd consider that for other reasons in regards to the baby growing up and having a life, its whole life ahead of it. Procedure C, you may have selected in terms of non-maleficence. There's a chance of saving both parties and the least loss of life could be achieved via procedure C. However, this is not what the mother has chosen, and therefore it's not an option in this situation. Option D disregards autonomy because it's waiting for the father to arrive to ask for his decision. And in this case, that's not what you'd follow because it's not following the principle of autonomy. Since the mother is competent, she is entitled to make her own decision, and the father, although he might have a say in trying to suggest his ideas to his wife, it's not something which would be taken directly into account when making the decision. The final decision would be the woman's and the woman's alone, assuming that she is mentally healthy and competent. Right, so hopefully you understand the logic behind the answer to that question, which is B, and hopefully now you'll be better equipped for similar BMAT questions or similar questions in general in the future. So yes, we hope you've got the answer to that right, and if not, we hope you understand where you went wrong. So as we said, the answer is B, since the woman has given her consent. The doctor must undertake it even if it kills her. She is mentally healthy, so she's able to make decisions for herself. We're going to finish now by looking at an example interview question regarding the topic of euthanasia. And we're going to ask whether euthanasia should be legalized in the UK. We're going to look now at a bit of background information regarding the theme of euthanasia. It might be something that you've heard about before, because it's also known as assisted suicide, and it has been in the news lately. It's the act of deliberately ending a person's life in order to relieve their suffering. However, it's currently illegal in the UK, but it is legal in other countries such as Switzerland, and organizations such as Dignitas will carry out euthanasia with no legal repercussions. And there's a number of reasons why it's illegal in the United Kingdom, but we're going to look at some of the pros and cons of euthanasia in regards to the 4 medical ethical principles. So yes, let's link euthanasia to the 4 principles. Before we do, though, I'd like you to just pause the video and have a think about this question yourself, just to see whether you understand the principles and whether you can apply them to this situation yourself. So please feel free to do that now. Okay, so hopefully you've had a chance to pause the video and have a think about this question. We're going to look first at the principles of autonomy and beneficence. And we can see here that euthanasia does allow both of these to be followed. It allows patients to make decisions for themselves. However, you could argue whether the patient has the mental capacity to make this decision, especially if they're in a lot of pain. That might affect their ability to make an informed decision. Understanding all the facts, for example. Beneficence, we know that it relieves the stress and suffering the patient is experiencing, so it could be argued that euthanasia does good for the patient, which is what beneficence is about. However, we know that euthanasia doesn't follow the other 2 principles, non-maleficence and justice. In terms of non-maleficence, it disobeys the pillar, as doctors are forced to cause significant harm to their patient and also to their family through emotional distress, perhaps. Although this might be argued that the family may not feel distressed if they also believe that it's in the best interest of that patient and they're supportive and happy for that decision to go ahead. justice, we know that euthanasia disobeys this pillar as it could be discriminatory against people with physical disabilities. And that's because able-bodied people can legally commit suicide, but disabled people require assistance, which is illegal. Right, so hopefully you understand now how euthanasia links to these 4 pillars, and hopefully you can also understand that it's not black and white in this situation. There are points on both sides, and that's why it is a heavily contested and debated topic, especially in this country, and that's why several countries disagree on their laws surrounding it. So, we're going to ask you now about what you think about this situation and how you would argue your point, perhaps using the medical ethical principles that we've discussed in the previous slide. So this isn't a live session, so you can't comment your answer in the chat box, but we'd like you to perhaps write your answer down on a piece of paper. If you like, please do write your answer in an email and email it to us. We'll be happy to hear what you have to say regarding this topic, but it is a very interesting one. And it's interesting to try and formulate and develop your own views on this, especially when using the principles that we've discussed in the past. Okay, so that brings us to the end of our session today. Thank you very much for listening, and if you do have any questions, then please email us on themedicaldebate@gmail.com. Please do follow our Instagram, The Medical Debate, and please subscribe to our YouTube channel for all our videos on ethical principles, hot topics, and other important medical facts and details that are very useful to know when discussing topics from an ethical perspective. Thank you very much for attending this meeting or viewing this meeting, and we hope we wish you the best of luck with your future endeavors regarding medicine, and we hope you've learned a lot from this video as well. Thank you very much, and we hope we see you again in our future sessions, and we hope you watch our videos as well on this channel.